Morning, everybody. Thank you for coming. Let me ask a question to start off. How many of you or your family members have ever been seriously injured and taken to a trauma center? Okay, so 3, 4, okay. Did you get a chance to, was it you yourself or was it, okay, so there's one. So I can ask her all the questions as we go along in terms of what's involved in being a trauma center. And this is sort of it's very much of an overview. I only plan on taking a few minutes. Just to give you a flavor for what we do and why it's so expensive and all the services we provide. So we'll start, and then at the end, I'm going to give you just one little brief story and some pictures to give an example of why trauma centers exist. And I'll warn you all ahead of time that anybody who doesn't like to see bad pictures, well, I'll give you a chance to get up and leave because I do have one bad picture to show. But so we take care of all the bad things, and then Dr. Pritchard gets a chance to take all the credit for putting them back together again and making them look good again. So, and we appreciate that very much. So the question is, what is a trauma center? And I just put a few questions up here to help myself because I didn't put a lot of slides together. And the first is, what's the difference between an emergency department and a trauma center? What are the requirements for the highest levels of trauma centers? And that's a level 1 trauma center. Who says you can be a trauma center? Who makes the decision as to what hospitals are trauma centers and which are not, and what are the criteria that are used? What are some of the current challenges to trauma centers? And then finally, do trauma centers make a difference? And as we go along, if you have any questions, please raise your hands. I like questions, and that'll actually help me. It'll take up some time and make it a lot easier for me. So the first question is, what's the difference between an emergency department and a trauma center? Every hospital that's licensed as an acute care facility has to have an emergency department, but that really doesn't say anything about what services they have to provide. So you can be a heart center, take care of patients with chest pain, you can do all kinds of things, but what goes on in the emergency department is pretty much separate from what goes on in the remainder of the hospital. So an emergency department is a physical location where ambulances pull up, where patients who are walk-ins come into the emergency department and get treated for their illnesses, and then decisions are made as to what to do next. A trauma center is the entire hospital. The emergency department is only the point of access of that trauma center. It's where the ambulances pull up with seriously injured patients, take you to an area where you can get immediate care in the emergency department, and then you're only there for about an hour, roughly, depending upon what your injuries are. And then after that, you go on to other places in the hospital that are all geared up to take care of you. It might be taking you to the operating room, where you might have to go right away. It might be taking you to radiology. It might be taking you to the intensive care unit. All of the services that the hospital brings to bear are part of the trauma center. And that's part of the expense that's involved, because we have to be able to take care of all patients any time of the year, 24/7. Now, what are those specific requirements for trauma centers? I brought a little prop here. My pen. I want to spill my coffee on the computer. It's always a bad thing. This is called the Green Book. So this is from the American College of Surgeons, and it is what is required of different levels of trauma centers, all the requirements. And the American College of Surgeons is a national organization of surgeons. It is the leader, it provides leadership in the area of trauma across the United States. So it has been doing in this business of establishing what the requirements are for trauma centers for about the last 40 years. And it revises what it calls the book, the Bible, every 3 or 4 years. And the Bible goes through different renditions of color. There's been a yellow book, gold book, and a blue book, and so the current edition is the Green Book. As you get further out in colors, they're having a hard time figuring out what color to use. So green is the current color. And it goes through whole lists of resources that hospitals need to have to be a trauma center. And there are actually 4 different levels of trauma centers, 1, 2, 3, and 4. 1 is the highest. So let me just go through some of the things that trauma centers are required to have. First of all, let's talk about doctors. Trauma centers are required to have a trained general surgeon and a trained anesthesiologist in the hospital 24 hours a day, 7 days a week, so that if you come in from a car crash on the street corner and it takes you 2 minutes to get to the hospital, when you arrive in the emergency department, you've got a surgeon and an anesthesiologist there to take care of you. Then we have to have a lot of other specialists available 24 hours a day, 7 days a week, on call with about a 30-minute response time to take care of all of the other injuries that a patient may have. So for instance, we have to have plastic surgeons like Dr. Pritchard to take care of serious facial trauma and extremity soft tissue injuries. We need orthopedic surgeons to be available 24/7 to take care of fractures. We need neurosurgeons to be available 24/7 to take care of serious head and spine injuries. We need cardiothoracic surgeons to be available 24/7 to take care of major vascular injuries, major chest injuries. We need to have, as I said, anesthesiologists available. We need to have ophthalmologists, eye doctors available. So I'm sure I'm blocking on a few of the list of many. But the whole team of physicians needs to be available. In addition, we need to have all the personnel we need inside the hospital to take care of the patients at any time. So we need laboratory services, X-ray, CAT scan. All of those things have to be available at a moment's notice to take care of any patient. And the patient I'll show you at the end is just one example of that, and it's why we are what we are. So now every 3 years, the American College of Surgeons comes through and looks to see if we meet what it has listed as its standards for level 1 trauma centers. And so every 3 years, we have to go through a process of what's called verification. So the College of Surgeons comes through, because that's what the state of Arizona has put forth in its law, that the College of Surgeons will do this. So they come to the hospital every 3 years. They're going to be coming here in March or April, go through the entire hospital, go through all the records, and see that we meet all of the requirements that they have listed for level 1 trauma centers. Then the state of Arizona takes that information and they say, okay, you pass this verification, and so therefore we will designate you as a level 1 trauma center. So there's the verification process where somebody actually comes in and sees that you do what you say you do and what you're required to do. And then a political entity that says, okay, you're able to do this, so we'll give you the right to be able to do it, and we'll allow the ambulances to come to you and bring all those patients to you. So it's both a process of verification by a national organization, which is American College of Surgeons, and then designation by the state of Arizona. Yes?
How many level 1 trauma centers are there in Arizona?
There are, in the city of Phoenix, there are 6 level 1 trauma centers, 5 for adults and 1 for pediatrics. And then there is a level 1 trauma center in Tucson, and then there is a level 2 trauma center in Flagstaff, level 1 trauma center in Flagstaff. And then there's some lower level trauma centers scattered around the state. Yes?
So is it just based on geography of who goes there, or how is it?
The
one trauma centers near each other, or is it specifically spread out?
Well, first of all, any hospital that chooses to be a trauma center and can meet the criteria can be designated. So if 2 hospitals next door to each other were to choose to both meet all of those resource needs, they could do it. And in some states, there are geographic limitations. In other states, there are no geographic limitations. In the state of Arizona, there are no specific geographic limitations. So if you can meet the requirements and you want to do it, and you want to play, and can meet all the standards, then the state of Arizona will designate you as a trauma center. But it's really very hard. If you imagine all of the financial resources that it takes to put all those services together, from physicians to nursing to critical care to radiology to the emergency department, it's a huge expenditure on the part of hospitals.